In this live interview, it's my pleasure to have our expert on COVID-19, Dr. Maria van Kerkhove, who will be responding your questions. So please feel free to ask anything you want to know on how to be safe from coronavirus and how to protect others as well, and Dr. Maria will respond. Before the questions come in, thank you for being with us here, Maria, today.
Thanks for having me.
Just to mention that our colleagues, most of our colleagues are teleworking these days. It's few of us who are coming in the office to inform the public on what's going on the outbreak, but majority of the organization is working remotely. Maria, before we get new questions, would you explain to our viewers what is COVID-19?
So thanks for having me, Alex, and hello everybody out there. So COVID-19 is a virus. It's a virus, it's a coronavirus that was newly discovered in December of last year. And I say this is new because we don't have any documentation of this virus circulating in humans before December. It's a coronavirus, which is a virus that mainly comes from animals. It circulates in animals, and some of these coronaviruses will spill over into human populations. There are other coronaviruses like SARS, which is severe acute respiratory coronavirus, or MERS, which is Middle East respiratory syndrome coronaviruses. Those viruses spilled over, SARS spilled over in 2002 in China, and MERS spilled over in 2012 in Saudi Arabia. This novel coronavirus, COVID-19, was first identified in China in December in a cluster of people who had pneumonia.
Thank you, Maria. Can you explain to our viewers as well how COVID-19 spreads?
So COVID-19 is a virus that causes respiratory disease in the people that it infects. And the way that it spreads is through droplets, which are little tiny droplets of liquid that will come out from your mouth or your nose when you cough or you sneeze or you speak. And the way that it transmits is that if you sneeze, the droplets will move across to another person and can go into your eyes or your nose or your mouth. And so it's important that you keep a distance. You can see, the viewers can see that we're about a meter apart from one another, because when these droplets come out, they only go a certain distance and then they settle down. And the second way that you can get infected is through what we call fomites, which means that these droplets, when they come out of your mouth and they settle onto surfaces. They might settle onto a table or onto a chair, and if you touch that surface that's contaminated, and then you touch your eyes or your nose or your mouth, you can get infected with the virus that way. So it's really critical. I hope your next question is going to be, how do you prevent yourself from getting infected? It's really critical that you wash your hands, because even if the virus is on your hands, you can wash your hands with soap and water and it will kill the virus. And if you don't have soap and water, you can use an alcohol-based rub.
Thank you, Maria. I'm glad that you mentioned hand washing as one of the priority actions that we all can take to protect ourselves, but also others from coronavirus, because at the moment it's ongoing challenge that we launched on Friday, Safe Hands, and we are inviting all TikTokers to join our challenge and show us how you are making your hands safe. Are you hand washing or hand rubbing or both? Please follow our videos as well and join the challenge. Maria, so what are the ways to prevent coronavirus from spread besides hand washing or hand hygiene?
So it's very important that all of the viewers know that there are several things that you can do to protect yourself from getting infected. The first we've already mentioned. The first is hand washing, and there are several steps to hand washing, making sure that you use soap and water and that you get all of the different surfaces in your hands and your thumbs and both sides. The second thing is respiratory etiquette, we call, which basically means, like, if you have to cough or you have to sneeze, you do it in a flexed elbow. It's really important that you do that, otherwise you're sneezing and those particles can move. If you don't do that, then you can also sneeze or cough into a tissue, and then make sure that you dispose of that tissue into a closed bin and then wash your hands. The third thing that you can do is be informed. So right now, this is a new virus, as we mentioned, and so we're learning information, we're learning about how this virus spreads and every day. And so you need to know where the virus is you need to know if there's new guidance that's out there that comes from either WHO or from your doctors or from national guidelines. And to be informed, you need to go to accurate sites. There's a lot of information that's out there that's not good, unfortunately, which could be dangerous. So you need to know where you can get the right information and accurate information every day. You can come to WHO website. Or you can go to your National Ministry of Health or Department of Health's website to get the most up-to-date information on this outbreak, this pandemic.
Thank you, Maria. We are also advising some people to stay at home, and as I mentioned, most of our colleagues are working remotely. Why is that important, and how does that help to stop coronavirus from spreading?
So the way that staying home helps is twofold. First, we recommend that anyone that's feeling unwell, in general, if you're feeling unwell, stay home. It's a good rule of thumb. Give yourself some time to recover, regardless of if COVID-19 is around or not. Stay home for a few days. That's good. If you're feeling unwell and you have trouble breathing, you have to make sure that you call your doctor right away and you seek health care, because that's one of the signs for COVID-19 where you need medical attention. But what we are doing now here is most of our colleagues and most of the businesses have closed, and so people are working from home. And the reason that's been put in place is to keep people apart. So the one way that you can prevent yourself from getting infected is not being in contact with other people who may have this virus. And so if you have a physical distance, we sometimes say social distancing, which we really should call physical distancing, because what we really mean is a physical separation from one another. Shouldn't touch your face. A separation from one another, but you can still remain socially connected. TikTok is a great way, as well as other different technology, so that you can still feel connected with other people, but be physically separated from another person. If I could just say, don't touch your face.
Thank you.
Just don't touch your face. It's amazing how often you touch your face. I'll have to come back and look at this TikTok and see how many times I almost touched my face or actually touched my face. Your hands, have dirt on them, and if you don't wash them regularly, you can contaminate yourself. So make sure you try to avoid touching your face, especially your eyes, your nose, and your mouth.
Thank you, Maria. Thank you for mentioning TikTok, and as well, we are using several social media platforms to keep connected with public from around the world and inform them on how to protect themselves, and also on our work and new guidance. We're receiving questions, and we thank you very much for that. So the question is coming: who is the most vulnerable to COVID-19, and is it more dangerous for people with asthma?
So we do know from data from a number of countries that people who are most vulnerable for developing severe disease are people of older age, so people who are over the age of 60, 70, and 80 years old, but also people who have underlying conditions like chronic respiratory disease, like asthma, or cardiovascular disease or diabetes. So those individuals who do get infected have a greater chance of developing severe disease.
Thank you, Maria. Speaking of staying at home, somebody was asking, is it dangerous to go out to shop and do some shopping?
So there's a lot of national guidelines that are out there now that are recommending people to stay home. So it's important that you follow the guidance of the national authorities. If you're recommended to stay home, you should stay home. And if there's ways in which you can do delivery, if that's possible, then use that type of services. If you do have to leave your home, you can go shopping, but you have to follow the same fundamental rules. Wash your hands, use an alcohol-based rub, don't touch your face, practice respiratory etiquette, and stay apart from other people. The virus is not in the air, so it's not that you walk outside or you walk into a grocery store and you can get infected. You have to physically either have it on your hands and touch your eyes, or someone has to spread it through those droplets.
Thank you, Maria. Here is the next question. Should I be taking precautions with my pets, or can I still pet them?
You can still pet your pets. I mean, pets offer a tremendous comfort to everyone that has a pet, and so yes, you can still hug your pets.
Thank you very much, Maria. Somebody is asking, should we wear masks and gloves?
So in some cultures, many people do wear masks. Our recommendation at WHO for people in the general community is not to wear a mask unless you yourself are sick. And if you're sick, you should be at home. But if you are sick and you're in contact with other people or other family members, you can wear a medical mask, so one of those surgical masks or medical masks. And what this does is that this protects you from infecting other people. But what we really need to do is save the personal protective equipment, including masks and gloves, for our frontline workers, for healthcare workers who are caring for patients in hospital. They're the ones that need this PPE. And globally, if everybody were to wear a mask, we really run into some trouble. So please save those masks for the people that really need it.
Thank you, Maria. You mentioned for people who are staying at home and asking, is it safe to go shopping, that they may do online orders if possible. So there is a question I think would be good to clarify. Is it safe to order online and receive packages?
It is. It is safe to order online and receive packages. Some people are concerned that the virus may live on surfaces for long periods of time, but it doesn't last for very long on surfaces, and it can be cleaned through disinfectants.
Thank you, Maria. I just want to mention to our TikTokers that most of these questions are coming into our Meatbusters, how we call them. So you can follow our website. We are updating these regularly. So you may find some of these responses there as well when we are not live.
Can I say something?
Yes, of course.
I wanted to say something about the social distancing and staying from home. A lot of older people are going to be at home as well. And so it's really important that, especially the younger people, and I understand TikTok may have a younger audience, if you have your grandparents, parents or grandparents that don't use technology well, I can speak for my own parents, teach them how to use the different channels, whether it's Skype or FaceTime or whatever it may be, so that even if you're physically separated from people, you still have an emotional connection. So be patient with your parents and grandparents, I'm talking to myself here, and teach them how to use it, because this will be with us for some time, and people will need to stay home for some time, and we need to still find ways to remain connected with our family and our friends.
Thank you, Maria. Here comes the question again about physical distancing. Is it safe to meet friends?
So this is a good question. So the safest thing right now is to stay home. The safest thing right now is to not congregate, not group with your friends. That means not socializing in a traditional sense. Maybe you can socialize over social media, and give a toast to each other that way. But it means no play dates. It means no dinners. It means, a lot of recommendations that are coming from many governments are the bars and the restaurants are closed, and that's because we want to keep people separated from one another. So, we can plead with the audiences here just to be patient and to, suffer through this a bit, and we will all get through this. It's going to be difficult for some time, but we will get through it. But really try to adhere to the recommendations.
Thank you very much, Maria. Somebody is following up back on grocery shopping and asking, should I disinfect my groceries?
Well, you don't need to disinfect your groceries. You need to wash your vegetables and as you normally would. But as long as whatever you touch, whatever surfaces that you're touching, as long as you wash your hands afterwards, you're killing the virus that could potentially be on your hands. So just make sure that you do that and you will be okay.
Thank you, Maria. As we are new on TikTok as WHO, and maybe not all viewers are familiar with what is WHO doing in general, would you explain what is WHO's role in this outbreak and how are we supporting countries and people to stop coronavirus from spreading?
So the World Health Organization that we both work for, I'm based in our emergencies program, so the WHO Health Emergencies Program, in which we have two major groups. We have a preparedness group and we have a response group. My background is in emerging infectious diseases, so these high-threat pathogens that spill over and cause outbreaks every now and then. And what we do is we develop prevention and control programs for known pathogens. When we have a new virus, when we have an emerging pathogen, what we do is we work with governments, we work with all countries and all people to better understand what is this virus, who is most at risk, how is it transmitted, what can we do to protect ourselves, and what can we do to control this outbreak? And so what we do is we develop technical guidance around the area, all of these areas. How do you detect cases? What type of lab procedures do you need to have to be able to test people to say if they have COVID-19 or not? How do we treat patients? How do we develop risk communication and community engagement activities? How do we protect healthcare workers in terms of providing infection prevention and control measures? And so my team works on the development of guidance that we give to countries to implement all of these things. We also work with countries to help them in their management and control of an outbreak. I spent 2 weeks in China with a big team of WHO Chinese colleagues, where we were working together to better understand this outbreak. And we were there to learn from China to say, what are you doing to control this, so that we could teach those learnings to other countries. So we bring people together, WHO will bring people together under different technical disciplines. We do this a lot through teleconferences, and right now we can't do that through face-to-face. So we can learn about all of the different aspects of this virus, turn that knowledge into guidance, work with countries to see how they can bring this outbreak, this pandemic, under control.
Thank you, Maria, for very good explanation of what is our mandate and what is our work. Earlier you mentioned that this virus will be with us for a while and we will go through it together. So can you just explain from these experiences that who are overcoming slowly the virus?
The countries that
the countries, yeah. that there is a hope for all of us that we can actually do it and fight it together.
There is hope. There is hope, and I hope, I want all of the viewers to feel a sense of hope. Some countries, the situation may get worse before it gets better, but it is really important that everybody feel a sense of empowerment, that there's something they can do individually. There's a number of countries in Asia, particularly China, Singapore, and Korea, that have had really bad outbreaks. And they have now turned a corner. And what I mean by that is case numbers were growing, and they implemented a comprehensive set of measures to be able to control this. And in doing so, and taking these really aggressive actions, and by all of the people in their countries knowing what their role is in fighting this virus, they've turned a corner. And so now case numbers are declining. And in China, the case numbers are very, very low now. And for us, this gives us hope that you can control this virus. It depends on what countries will do. It depends on the actions that we will take. This is the first pandemic we've had in history that we can potentially control, depending on the actions that countries take.
Thank you very much. I just wanted you to share that message with our viewers, because there's a lot of fear and panic around it, but it's important to know that we know how it can be controlled.
Yeah. I mean, fear is normal. I think people need to understand that that's perfectly normal. What we don't want is panic. I've seen a lot of videos of panic buying, people going out and buying huge volumes of supply. Please don't do that. Please get what you need. And make sure that there's enough for everybody. But fear is normal, but it's important that we turn that fear into something positive, when we turn that fear into action, into something that we can do. And please help each other. If you can't grocery shop yourself, or if someone in your neighborhood can't, and you can go to the store for someone else, offer to do so. Leave the bags outside of their door, but do little things that can help one another, because we are all in this together.
Thank you very much, Maria. We're getting more questions coming, and one is about symptoms.
Okay.
Can you explain the symptoms, and who should a person call when they notice symptoms?
This is a good question. So because COVID-19 is a respiratory disease, it's difficult to distinguish between COVID-19 and influenza or the common cold. The typical signs for COVID-19 are fever, a dry cough, and shortness of breath, difficulty breathing. You may have some other signs and symptoms like aches and pains. Very few people have runny nose or as it relates to COVID-19. I mean, many people have runny nose in this time of the year in the Northern Hemisphere because of flu season, but that's not a common feature of COVID-19. So look out for fever, dry cough, and shortness of breath. If you have fever, cough, and shortness of breath, it's important that you call your healthcare provider immediately and seek care. But give them a call beforehand so that they know that you're coming and that they can prepare.
Thank you, Maria. What should I do if a person I live with seems sick?
If there's a person in your household that's sick, have them call your doctor. Give your doctor a call and explain what they're feeling, what kind of symptoms they have. But a doctor will also ask what kind of underlying conditions does that person have, because it's important to just not look at the symptoms, but also look at their age, look at their underlying conditions, and then the doctor will give advice on what to do. If you're generally feeling unwell, it's a good rule of thumb to stay home. But if you do have shortness of breath, it's important to go in and see someone. But give a call first before you head into the doctors.
Why is it important for people first to call?
So that's a good question. What's important for people to call first is because you need to have that advice of whether or not to go into a healthcare facility or not. What we don't want right now is a lot of people who don't need medical care to go into a healthcare facility and overwhelm the healthcare facility. But if you have any doubt at all, call your doctor right away and get medical advice. Don't take medical advice just from us right here. Make sure you speak with your own healthcare provider because they know about your background, they know about what medications you may be on if you have underlying conditions. But what we want to do is prevent a large number of people who don't really need to go into a healthcare facility from doing so that we save those hospital beds and those that time for the people who really need it.
Thank you, Maria. Someone is asking, are the symptoms in kids different or the same?
This is a very good question. So this, as I said, this is a new virus, so we're still learning a lot about it. What we know about the virus in children is that children are infected and children can be infected, but they seem to be infected at a lower rate than adults. We don't know why, but the children that are infected tend to have more mild disease. Not universally. We do have some examples of children who have had severe disease, and one child has unfortunately died, and this child died in China. But so far, overwhelming majority of children that are infected will have a mild disease, which will be similar to what you would see in a mild disease in adults. So they'll have a cough, they'll have a fever, they may have some aches and pains. They may also have some gastrointestinal symptoms like diarrhea or vomiting, but a small proportion.
Thank you, Maria. More questions are coming in. One is, can you get COVID-19 twice?
So I get this question a lot. So again, it's still a new disease. We're about 12 weeks into this pandemic, which is very early. And what we're learning about people who have been infected is that they can be infected and have symptoms for a few weeks, and then they can recover. But they can still be PCR positive. They can still show evidence of having this virus for some time. The question is whether or not they can be reinfected. We don't believe so, but we need more tests to be able to look at the immune response in an individual, and those are called serologic tests. Those are looking at an immune response. Those are new, and we don't have full data on that. So I don't have a complete answer to that yet, but we don't believe so. I'll have to get back to you when we have more evidence on that.
Thank you, Maria. Based on current evidence, do we have information on mortality rate? Is it only happening in older people or it can happen in younger? You mentioned that unfortunately one child died, but what is the current evidence we have?
So when we look at mortality, we look at how many people have died based out of the reported number of cases. And so usually we give a percent that'll say 2 to 4% of people have died. There's a problem when you say that because when you calculate that, you calculate the numbers of deaths over the number of people that have been infected. And what that bottom number doesn't tell you is the number of people who have had mild disease that haven't been picked up through surveillance systems, or have had a subclinical infection and would never get picked up through a surveillance system. So when we look at the total number, or the extent of infection in the population, it's likely that that percent number will go down. What we can say is that mortality is higher in older adults. It's higher in people who are 60, 70, 80, above 80 years old. And it is higher in people who have underlying conditions.
Thank you, Maria. Question is coming, and we've been receiving this a lot as well. What's the difference between flu and COVID-19?
Right, so they're both respiratory. I'll tell you what's similar first. They're both respiratory diseases. They're both viruses. They both cause a range of disease from very, very mild to death. The difference between the two is how it spreads. Well, they both spread by droplets, but in flu, the main driver of transmission, which means where circulation is happening most, is in kids. And we don't see that with COVID-19. And COVID-19 spreads faster. So the time between someone infecting someone who infects someone else is much faster than influenza.
Maria, somebody is asking, how long do the symptoms last?
Well, that will depend on a number of things, but we know that people who have mild disease, from the time that they develop symptoms to the time that they recover, is around 2 weeks. For people who have severe disease, it may be a little bit longer because they're in hospital so it'll be maybe 3 to 6 weeks.
Thank you, Maria. Someone is asking, how is the test done? Do they take blood sample, or how does it work?
They use what looks almost like a Q-tip, and they put it in the back of your nose, really high up. It's a little bit uncomfortable, it's not painful. Or they do it in the back of your throat. So it's a swab. We call this a nasal swab. And then for people who are in hospital, they may take a lower respiratory sample, but that's only if you're in hospital. And then they test that. But it's not, this for PCR testing, it's not a blood test.
Thank you, Maria. Somebody is asking, what about people with immunity disorders? And I think you mentioned that earlier, but maybe just to summarize again, who are the most vulnerable to COVID-19?
So from the evidence that we have, the people that are most at risk for severe disease are people with underlying chronic disease, cardiovascular disease, people who have diabetes, people who have cancer. I don't think I mentioned cancer before. So people who have immune deficiency, yes. What we don't know yet is what this virus will do in other types of populations. So right now, the majority of transmission is in Asia and in Europe. We're seeing it in North America. We're seeing some starting of circulation in Africa and in Latin America. What we haven't yet seen is how this virus transmits in high levels of HIV population or in malnutrition children. So this is a worry that we have because we want to make sure that we protect as many people as possible. So if I could just say that in protecting yourself from infection, you're actually preventing onward transmission. So not only are you helping yourself, you're helping other people. And this solidarity is something that we really need. So the fact that you may be young and healthy, if you prevent yourself from getting infected, you may prevent infecting a vulnerable person. And that's what's really, really key. So every person has a role to play in this pandemic.
Thank you, Maria. And here are a few last questions. Does COVID-19 affect pregnancy? Can the baby get it? Do we have any evidence on that?
So we do have some evidence of COVID-19 in pregnant women. And from the data that we have, it doesn't seem to cause a different disease in pregnant women as it would in the same aged woman who's not pregnant. So that's good news. And we haven't seen transmission go from a mother to the fetus. And so that is good. We've just recently put out some updated clinical guidance for adults, and which also include pregnant women. So that's on our website for the clinicians out there.
Thank you, Maria. And someone is asking, is it safe to fly these days?
So it's all about what you do wherever you are. So whether you're on an airplane or whether you're going to the grocery store or whether you're outside of your house or at work, it comes back to the fundamental aspects of protection. Hand hygiene, wash your hands with soap and water or an alcohol-based rub, respiratory etiquette, and keep your distance from people and be informed. So know what's happening, know where this virus is. I've seen a lot of flights canceled, so also be patient, with as we sort of navigate ourselves through this tough time.
Thank you, Maria. Thank you so much for your time. Thank you for informing our viewers how they can protect themselves, but also how by protecting yourself, you're protecting others. And it's important that we are all in this together and act in solidarity. And it's also important that we know that there is something that we as individuals can do as well to support the efforts of scientists, medical workers, especially health workers on front lines, and governments who are trying their best, doing their best to try and control coronavirus. Thank you very much once again. Thank you, TikTokers, for watching us, and please keep following and watching our videos. We'll do our best to have more often of these live sessions with our experts so that you can ask them questions directly. Meanwhile, we will try to provide as much as possible our information in some interesting videos. And don't forget to wash your hands or rub your hands and join our Save Hands Challenge. Until next time, goodbye from the World Health Organization.